Hello, welcome back. It's another Q&A from questions heard while working as a massage therapist. I have a master's degree in data science. I have an undergrad from economics and math. I passed the CLEPS calculus, trained myself from a CLEPS book. I bought it at Barnes & Noble. Never had calculus experience, but I did have like all the other stuff before it. When I was younger, to get into the program, to get a grant from UCSD as an IGETC, intersegmental general education transfer curricula back in 2013. And then I did 3 years of chiropractic school, made it to clinicals, got my white coat, kicked out because I shared my lab recordings. They allowed us to record, shared it with my friends. I thought they could benefit. And I feel like anyone who's on camera should have the right to know like what was on camera. So anyways, I didn't edit it because it takes too much processing. And I was in school like 24/7. It felt like all the work you have to do in class and then out of class studying. So I'm here to share with you knowledge I have from that time in chiropractic school and how it applies to basically our scope, which is the same, except that we can't do adjustments and we can't prescribe. We can advise because it's considered suggestion of the wellness plan. It is within our scope because massage therapy does work on your body as long as it's a soft tissue complaint, such as your tendons from attachment site to attachment site under the bursa, myofascial covering it, the fascial trains, the ligaments that go over different sections and depths of muscle that allow us to work in coordination with other muscles to do movement. And then also the ligaments, a ligamentous sprain. You have a sprain if it's a ligament, and that takes the longest to heal because there's not a rich vascular supply unless you have the fibroblasts injected into that region with an ultrasound from a professional medical doctor who knows what they're doing. Then you will heal faster. But typically that one takes the longest to heal, a full-on ligamentous sprain. And then the next injury is a tendinous strain. That one has grades just like the ligamentous sprain because there's a complete rupture. That's the worst grade. And then there's the lower ones, which are just the fibers. When you get a knot, it's those fibers that tear when you're constantly doing stuff. Every muscle is made up of other little bundles of that muscle in little myofilaments, and each one has its own blood supply and nutrient supply. And those ones break down, and that's what causes the knots. That with the fascial and the way that they're laying there, and then in a stressful situation, your body can't clean that. You don't have a serious tear, and you continue to provoke that pain and make it worse by not resting, not stretching, not hydrating. Hydration is important because we need electrolytes in our body. The calcium that it takes from our bones, the sodium, we do need sodium for the sodium potassium pump to our nerve impulses. People do die from not having enough sodium in their body. So if they're always sweating, they're low on electrolytes and they need to get them. Many electrolytes, just like the chemistry table, like phosphorus, magnesium, nitrogen, calcium, other ones, chlorine even. And so if anybody has any questions directly, you have to be a member or a subscriber. And it's in this list. Sometimes it doesn't let me play it, so I'll have it unlisted and I'll just post it. But I'm not really too worried about it because over time, people look up that stuff and eventually this page comes up. So we did learn a lot in school. We got a very thorough anatomy review, lots of rigorous testing, immunology and infection. We needed to talk about that. We talked about that on earlier discussions. Q&A with our inflammation response, the stress response, and the rest and digest response. The peaceful healing state is our rest and digest parasympathetic state of the autonomic nervous system. The other one is the stress response. Most people have a lot of stress nowadays to live in society and function properly and have everything they need to be happy. What is happy? Well, that changes as we age and our needs. When you're a little kid, of course, you want to fit in and be with your peers and be popular and have the latest stuff and whatnot, and you don't have to work because your parents provide everything for you. That's the American idea family. But in other cultures and other places, they're probably their needs change as to like what they're going to eat for the day or if they're going to eat. So I mean, it depends on your culture, your upbringing, your social economic status. Yeah. So I mean, yeah, in most countries actually kids can't even work. So I have been working since 15 and a half, and most people around my age have because of capitalism and everything that you want and need, and especially whenever you don't have parents home all the time. So most families, and then it just got worse with aging and time. So everyone has to work. You don't even have the family net. So it used to be don't have kids until you're older and you go to school bachelor's degree, or you're doing well, you're making great money, so much opportunity. Now it's like no, you need to have kids when you're young. You need to take it from me. If you have that family network there and they're supporting you, take advantage now because they won't be there when you get older and your eggs will die by 35. 35 will hit you fast, okay? Especially if you're going to get a bachelor's degree, master's degree, doctor degree. If you're going that route, you're going for a lawyer, any of that stuff. Unless you have a good job, not guaranteed with any degree. You have to go out and know people, literally go make connections and know people. And that does take from your studies. And if you're slacking on studies and you blame everything on your studies, you're going to spend all that time studying and not make those connections. So you need to make those connections, and you need to just know how to keep relationships going. Keep in contact. Yeah, it sucks sometimes because if you're an introvert, you don't like to have to kiss anyone's ass all the time. But you know what? That's life. That's what you have to do. You have to make those relationships and you have to listen to people. And then you'll find out later on if they're toxic or not, because if they don't listen to you and they don't remember anything about you, then you're just there to like support them. And you don't need that, okay? So, I mean, you do want to keep good relationships, but that's about it. Okay. So what I've been hearing when all the types of clients that I've massaged, they're usually injured already from chronic injuries. So we get the older people, the lower back pain, lower back. So in chiropractic school and everything, you may think posture is not a big deal. And you might think, oh, posture, yeah, okay, I'm so young, not going to be crouching my back. I'm going to be fine in 40s. I work out like 3 or 5 times a week. Things change. You have to work. You have to sleep. You're going to start prioritizing your sleep more than going and doing anything fun. So when you're fit and active, you want to do things fun. You want to do whatever. You want to go have fun. You want to stay up late. You want to like miss sleep and hang out with your friends and, blah, blah, blah. Then when you get older, time goes on. You start working stuck in a chair or stuck on your feet, moving, making some numbers, moving stuff around, showing your work. You're tired. You're exhausted. You want to go home. You want to eat. You want to lay down. You want to relax. But you got to work out. You got to hang out. You got to socialize. So all of this is part of the human way of life. And pain, psychosocial model of pain. Biology, if it is something wrong with you that you can feel, that's pain. If it's hard to locate and it's spread out over a different region, it's probably ischemic pain. If it's sharpshooting and you can pinpoint it, it's most likely a nerve compression. If it comes and goes and it's colicky and it's sharpshooting pain, it's a nerve pain. But that could be from anything like a kidney stone, depending on where it is, because it's colicky. It could be from something that's constantly having to open enclosed like your gut, also with the kidney because of the vessels contracting and whatnot to flush out urine and all the stuff that goes through it, like the protein, the glucose, electrolytes. That can cause some colicky pain as well. Anything that does that. If it's a boring pain, as in it feels like it's boring into your bone, that one is not really something that massage would handle. That is more like a deep visceral pain, they describe it, or it could be in your bone. If you have a feeling of numbness and tingling, that could be compression of your neurovascular supply. So your nerves run with your blood vessels. The arteries supply blood throughout your body, except for in your heart or when you're supplying blood to a baby. That's whenever the blood that leaves your body, because the blood that leaves the heart, that leaves the lungs, is oxygenated at that time, and that's the only time the blood from the lungs and the heart is deoxygenated. Same with the baby. The blood entering the baby is or leaving is oxygenated and deoxygenated. It's like the crossing of so the blood leaving the woman's, so whenever they implant on the uterus, the embryo, there's a blood vessel growing onto it. It latches on, takes its blood like that, has that little membrane sac in it. So the blood from the uterus is also oxygenated. That's leaving the uterus to go into the baby that's growing. And so it's just backwards. That's what it is. And then so low back pain, we could talk about that. That could be from reproductive, that could be from gut pain, that could be from the fourth vertebrae. So in chiropractic school, they left out one of the F's because it was obscene and cultural standards. They didn't want, it used to be okay to call people fat, like, you're not cocaine skinny like the 80s. You're fat and lazy, right? But now, and for the last 20, 30 years, they've decided not to use that word. And the chiropractic school has been around since like the early 1900s. So they had to change it, but there was a mnemonic for it. It's female, fat, 40, fourth vertebrae, 4 F's, is for low back pain related to females in their 40s at the L4, L5, right above the iliac crest from sitting all day. They could be driving, they could be at a desk, they're sitting, they don't move, they can't go to the restroom because they're clocked. Their manager's constantly watching them. Nah. You're going to get docked for that, right? So they are not emptying their bladders. They're not circulating. Their gut is really, it starts to get weak, especially if they're not working out. And because we have our spine and we have all these muscles that hold it together and we have the discs between it that hydrate, the gut has to be pushed up on the front to hold the spine in, which they don't tell you because you have your spine. We'll just use this spine. Okay, we'll use this. Your spine, right? Okay, then you have like little discs in there, right? And this is like the back of your spine. And then the back of your spine, and then you got room for like your spinal canal right there. Here's your big disc right in front, all the different vertebrae, right? And then they move a certain way. And then you got your aorta in front of it. Then you got your vena cava somewhere to the side. But you have muscles in the under and around it. So in this front right here, you got to hold your gut. Your gut has to be in, holding it in place, okay, to support it and keep it from moving forward. When it starts moving forward, you get stuck in that position, and your QLs, quadratus lumbar. We're gonna go into the app, and I'm gonna show you some stuff. So I'll just go ahead and show you because, hey, I have a cool app completed now, and I just want to inform you guys because I'm a professional health provider. This is part of autonomy on how you can heal your body by knowing what is going on in your body. Because some people just don't tell you, you know what I mean? And sometimes you just have to grow up and know that, okay, I'll believe it because this superstar over here says it, because some fitness influencer says it. What's her name? What's that lady that's been around forever? I want to say her name's Austin. It's like Donna Austin or something. I don't know. So, anyways, here we have the low back. I'm just gonna move this around. We got the sacrum right here. Oh, a lot of people have been coming up with sacroiliac joint pain. This is our sacroiliac joint right here. See the sacrum? You see how this one's kind of out more? If it goes out a little bit more on a almost horizontal, they actually got, what is it called? Plasty. It's like, well, that's usually a little person because of the way their hips are. But this is kind of pronounced sacrum. All right, so the sacroiliac joint is also an interesting number, but okay, for the female, fat, fourth vertebrae, and 40 after years of sitting at a desk, being stressed, not being able to urinate. Let's just look at everything that's going on there. Okay, this is why you get low back pain. Okay, right here. Very simple. You don't know anything about it because nobody tells you, right? But I did 3 years of chiropractic school. This is a big deal. Like 20% of their money right here, the low back pain. So you got to fix all the like muscles. If you're starting to off here because your gut's starting to pull because your abdomen, this gut has to be right there. What's that? The arteries. We're going to see the abdominal aorta right there. We can actually fade this. And then we can go in there. So our large intestine is attached by ligaments to our abdominal cavity. These little blood vessels you see there, those are part of the mesenteric. You can see this designed to have a strong abdominal support, but look how close it is to the now. Some reasons that the gut goes forward when you're sitting down is the abdominal muscles get weak. So this starts to go out. Makes this weak. And then you have the psoas deep in here attaching to the inside of the ilium, and each of the T12 through L5 discs and vertebrae, right, starting to get short. Attachment sites, you got the QLs, trunk flexion, hip extension. No, not hip extension, hip flexion, trunk flexion. Yeah, because it's just going forward. It's in near the front, anterolaterally. And then you got the QLs on the back side attaching to the ilium. Those are for extension or lateral bending to the side, or just side bending, lateral flexion. Those can get tight and they start pulling more, pulling. And then what you get with this fourth vertebrae is you're like, why the fourth vertebrae right there? Because these little objects right here that are housing the top of where the nerve rootlets come out of, right here and right here. Well, this fourth nerve root right here This fourth vertebrae can actually pass here. Inner articularis, well, this is what happens when you get kicked out and refuse to look at it. But it's like the pars inner articularis, neuroplasticity. It's always there. You just gotta get some nerve access to it. It'll fracture from all that weight, all that compression, all that pushing forward. Minerals being sucked in by your bladder. You can't circulate any blood because you can't pee, and you're stressed because you have to keep going. From sitting at those jobs all day. It happens. This isn't relevant to men. Men, it actually happens usually right around here. This is the sacrum right here. Oh, actually, this is the fourth vertebrae right here. I was looking at it wrong. Sacrum right here. Fourth vertebrae. The men's happens right around here when they have low back. But with men, low back pain can be from testicular cancer as well. Testicular cancer is like something that is average age. Prostate cancer is something that happens after age 50, approximately. On average. So if you're a younger male, testicular cancer possible. And if you're an older male, prostate cancer possibly. But you'll also have a stream of pee. You can't pee fully, and it'll be annoying. That's what they say, anyways. And then that's outside of our scope, though. We don't do that. But if it came to our knowledge in session, someone said that, we would refer them to somebody to get looked at because it's a possibility. But we would never go near that as a massage therapist. So, yeah. That's another scope that we don't have as massage therapists with chiropractors is we don't go into any oral cavity, but they can wear a glove and go in the mouth and in the anus to correct the coccyx right here, which can get this right here, which can get mal-shaped during pregnancy or when your body's realigning. Usually it's in female and basically out with the glove finger, but most people don't do it because it's so risk of getting sexual assault claim, so they just avoid it and just send them out somewhere. So you do see the abdominal aorta. You can actually have an abdominal aortic aneurysm develop in your body and not know it, and then it bursts and then you die. But palpate it usually right above the belly button, right about like 4-finger widths up here, right here. If you can feel it between 3 to 5 centimeters, but more than 3 centimeters, but more than 5 centimeters, you have an enlarged aorta. So it can get pretty large. That's not good. So that's when you need to go to surgeons, medical doctors. You just go to the ER. Anytime you need something, go to the ER. Because if you have an HMO and you wait for your regular doctor, you're going to die before you get it. Handle all the other stuff later. Go to the ER. The ERs will a temporary doctor of your primary care physician, and until you get to that person, because everyone's so busy now, they don't have time for you. So, and insurances make you stick with that person. It is life or limb in the ER. Okay. If not, go to the urgent care. But that's life-threatening, so they have to take you. Okay. And usually metastatic cancer also spreads to the spine, not the long bones for the adults, but in the kids, it can be the long bones due to the way that they still make blood. They still make their lymphocytes, their granulocytes, their white blood cells, and the red blood cells are still made in the long bone. Older people stop making that because their end plates have already closed around 26, 27, and they're now more like that. So they need to move. Also, when you got injured, that's going to lead to arthritis when you get older unless you keep mobilizing and whatnot. Okay, so this fourth vertebrae in females. So this little thing, this pars inter articularis right here, this is a bridge. Call it a bridge. I'm just tracing it right here. It cracks. It starts cracking, and then what happens? You got these titles getting even shorter, shorter, shorter. That's them for life. Just short, short, short. Pushing it, kind of like a bow and arrow, just down. And then gravity, and you're gaining some weight. You got uterine fibroid in here, pulling it down, large as a baby over time, while you're just thinking you're fat and you can't lose weight. Damn, I got old. That sucks. I don't know. Well, because you haven't been getting your health checkups, So you need to get the tumor cut out before it gets that big. So the only way you can get rid of tumors, detect them first, do all you need to do to be proactive, because the only way you can get rid of tumors, unless it's a blood tumor and not tumors all the time, is to get it cut out. In vitro to destroy tumors, but they also destroy your organs, and they'll kill you before they kill the tumor. So you just have to get it cut before it grows, and that's it. So that little crack, where is it? Fourth vertebrae, this little bridge right here, this vertebrae starts shifting. And they call that a spondylolisthesis. And it slips 25%. Then it slips 50%. It's right over here now. Then it slips 75%. It's right here. And you're like, how does that happen? How do they not know? Well, they had chronic back pain. Their muscles got shorter. You have a lot of dense connective tissue. This is just a support structure. It really is. And there's some movement. It glides you in movement. It's a support structure. So your body, if it keeps changing to these adaptations, or it already ends right here, and it's just the nerve root. Let's L1, L2, and then it goes outwards from there. So your nerve roots are they're still going to be out there. You didn't really impact your spinal cord, but other stuff does start changing. And then if it falls completely off the spinal column, the psoas is attached to it. It's still attached to the disc. You most likely don't have the discs anymore. They're already bony arthritis. And then you have your QLs too, and like you just have like a lot of weird stuff going on. You're just like, maybe you got a lot of, you have to be obese, fat. You have to be like morbidly obese actually to have this going on. And then you probably have other pain on like anti-inflammatories. I mean, that's just how it is. Unless you're working out all the time and you're happy, you're sleeping regularly, you're taking your fiber, you can eat whatever you want and not worry. Blood pressure is good, minimal fat, only working out to socialize, but you still look good. Then you're probably not at risk of anything yet, because life happens and stress happens, and you've got to meet with every life cycle you go through when you get from your puberty to adulthood or young adulthood, and then you get into adulthood, and then you want things. You got to start making money for those things. You can't be in two places at the same time. You got stress, you got expectations, you got to meet those expectations. You might have to like clean up after yourself, then your kids, then your pets, and or vice versa, or some other mixed way, or maybe your husband too, or then you're like, hey, F this, that husband's not doing anything. Let's get rid of the husband. Or like you have to deal with other stress, and it's like, So biopsychosocial model of pain in healthcare. Biology is so that you have some pain. We take care of that pain. We get you on a wellness plan because it's a holistic massage therapy. Holistic healing is the whole body. Biology, psychology, and your social life. Are you able to meet your expectations? Do you find yourself having to lower them? Do you find yourself less happy with them and you accepted lower expectations? Limiting your boundaries. Because maybe your standards are too high. Maybe you got to lower them, and then you have to accept certain things. Don't have time for things. You start prioritizing. Start making time for kids in your social life rather than friends and partying. Start making time for your parents if they're aging, and your kids. Kids are getting older. They're going to be off with their friends and do their own thing. Start making time for your loved one, your partner, because you guys don't spend time and now you can. Church, school, work, traffic, sitting there shopping, socializing with your neighbors, and whatnot. If you're into that, depending on what area you're in, maybe avoiding your neighbors. I don't know. Yeah. So then we get into the psychology. Do these life expectations that you can't meet, do they make you depressed? Do they make you angry having to deal with people and not getting taken seriously, or being, you're taken for granted all your work? Maybe you have pain now that's intensifying from all that other stress, or maybe you got sick and you're like, I'm stressed out, I don't know what to do. That's part of the psychology of pain, because we have our muscle and our visceral pain. Visceral pain from the sensory goes up our spinothalamic tract. It's going to go through the dorsal columns of the spine. All the little nerve rootlets they share, they intersect, they meet at the little ganglions, they go to the spine goes up, and actually all your sensory, it has to synapse and go through your spinal cord, cross, and then it goes up, synapses again, and then it goes up to the other side. So that's all your sensory. You got pain in this arm, it goes to the spinal cord, crosses, synapses here, synapses at the medulla, and then synapses in the cortex of your brain. That's the spinothalamic tract, thalamus. Now, the motor tract is in front of the spine. That was in the back of the spine. Dorsal for posterior for back. Now we got our anterior, which is the front, and that one is for motor functions. So motor, like if you need stimulus to your gut or to your stuff you can't control but your brain, such as like your pancreas and your stomach, digesting food, need motor functions for that, to shoot off enzymes, same with the liver, enzymes, bile, digest those fats and proteins. The heart, you need to raise fat, oxygen, you need to pump more. Getting adequate oxygen, slower the heart rate, coming from the brainstem, the medulla oblongata, same place that it I guess they call it decuss, whenever it depolarizes, sends the electric synapses, those nerve ganglions. It's like a housing to send off the fire potential to send it. That's for motor function to your skeleton as well. You want to lift something, flex your bicep, coordinate, assist that movement, keeping these there, and your shoulder intact, not having it slip out. Motor function come from the cortex of the brain after taking that sensory, and then it goes down to the same side. Decuss here, goes down to the nerve root level of the spine, crosses, and then it goes to that organ or to that muscle on that side. Okay, so the nerves are coming out bilaterally, two sides from the cord right here behind your bony processes of your vertebrae. Behind the pillars of your spine, the vertebrae, and then in front of the bony posterior processes of your spine. And there are certain movements that go along with it that the joints help to prevent overextension of your body and slippage. And they release when you move. You got to keep moving because you're always sending those fibroblasts there. Not everyone can have those plasma-rich protein injections. Medical doctor inject them with an ultrasound into your labrum of your shoulder or menisci of your knee right in here, or the labrum of your femoral acetabular, or any ligament in your body. Yeah, so you have to strengthen your abs for the lower back pain, and we'll add another layer of muscle. You can see the that's either the psoas or the QLs. Psoas major right there, right by the side of the spine. You got your iliocostalis as well that runs along these ribs to help you with posture. And then these deeper rector spinae, either the spinalis or the multifidus, and the rotatores and the levatores, because those are for the ribs and elevating those and assisting in breathing and holding up the spine. All of these muscles, can you imagine when that vertebrae for low back pain slips off? Like if they were to see not everyone gets x-ray, not everyone gets medical checkups, so they don't know. Even some people don't even know that their heart and their liver and spleen are on their opposite side of the body, like that actress that passed away. She had inversus. It's like something inversus with the organs. So the heart is usually right here. Right here, it's like from the second to fifth rib, the PMI right around there. Then you got the aortic, and then you got the pulmonic right around there, second, third. Yeah, right in there. And then so it's a separate thing, but like the heart from the four chambers. And the heart will be shifted more in I want to call it in situ inversus, like in the body instead of in vitro. It's in situ inversus. The organs inside the body are inversus. They're opposite. So this little opposite side, and the spleen will be. Many people never famous would not have known either because she may have had children, but I guess even with an ultrasound, because they're just going in this area, over and over, mirrors each other, the uterus, bladder, never had to go into this area, never had a chest x-ray, or maybe the person that did have a chest x-ray, because you have it at two levels. You could see one for organs. She never had to have her organs looked at. Or maybe it was just above the area. Or maybe it was at a time when you're pregnant and the baby is pushing up as it's growing, because the uterus, as it grows, starts moving up from between the bladder and the rectum to a bladder, and the baby is going to face downwards. The feet could be in there, maybe moving stuff around. It is odd, though, that nobody detected that in her for 72 years, not even at birth, at any time. In the mid-50s. Very odd, but yeah, so that's one reason you can have low back pain. Let's just add that muscle layer. So we got our transverse obliques holding it in. When we add that fascia, you can see the fascia lining doesn't just cover one. The fascial trains don't just cover like one section of muscle. They can cover a whole area of muscles. We'll add some connective tissue. And we'll start seeing that fascia, the fascia linings. You can click on it. That's the deep fascia of the back. Here's the deep abdominal fascia. Interacting. And then pectoral fascia. This right here, the deltoid fascia. All those fascias, they can be compartments. Routine or damage. So that can also form knots. little tears in the fascia, tears in the muscle, tears in the myofascial, covering the fascia lining over the muscle. Get the fascia. So that was the deep fascia of the back. Got our gluteal fascia. Sometimes look where that extends. That can feel like burning pain. So if you get too much fluid in this fascial covering, it can cause stretch receptors that are nociceptors. They detect noxious stimuli in the body. They can be burning, tearing, itching, ticklish sensations. It's sensory, so it still goes through the dorsal spine. But burning isn't a typical sensation that they teach in chiropractic school, but you'll hear it. It's not part of their regular pain, numbness, tingling, sharp shooting, that kind of pain. Burning doesn't usually go into it, but they do say in different coursework, or you'll hear it from people and you're like, where does that fit in? Sharp shooting, still achy, radiating, feels like ants traveling. So yeah. And so the fascial pain, there is a way to see and detect if you're getting better, if you wanted to see if massage is really helping a condition. If it's soft tissue, chiropractic school only says 15% of their patients have soft tissue pain, and they measure it with tenderness to palpation. They gave the 2 a T, so it's TTP, tenderness to palpation. So you palpate it, you touch, you feel a knot, you feel an ache or a tender spot. May not be a knot, but it may just be tender and restricted. If there's 4 levels of tenderness to palpation, and it's in our scope, not something massage therapists, not that bad. A 4 is the worst. A 1, I can deal with it. A 2 is like, ow, that hurts. Ah, that hurts. I'm going to pull away from it. Ah, don't do that. Ah, like, touch and flicking at it. A 3 is, don't touch that. Wait. Yeah. Yeah, the deeper you can go and not have to withdraw from it is a lower score. Now, if it's a 4, that's the worst. You just barely go over the surface of the area and they're like, that's a 4. Now, because it's soft tissue, if there's nothing physically there, if there's no signs of inflammation, which are the 5 cardinal of inflammation, which is limited radiation, pain, swelling, redness, or heat. Those are in the initial state of tissue injury. Well, then you have to palpation, or also with it, and see what can be done. Can massage therapy help it? Can we get it from a 4-1 or completely better this session? Well, if it is in the acute state of inflammation, most likely not, because it has to heal and your body takes time to do that. But it could be in subacute, where as limited range of motion, it might not be red anymore, might not be that painful, but just a little painful, where you can rate it with the tenderness to palpation. And then swelling, there might not be any swelling. So less than 5. Not an incision. We're not allowed to go over any open wounds, no infections, no vesicles inflamed, no rashes, none of that stuff. That's why you don't really massage someone in complete darkness. I hated working in couples room when I had to massage someone completely black. I did not. I'm pretty sure it's from that style of doing massage. That was a long time ago. That was a different place. But you need to see that they don't on their skin, because that's communicable, and you're not allowed to massage them, depending on what it is. If it's shingles, that's highly contagious. So you definitely, or even sometimes warts. Of course, warts. Yeah, don't want to get that. Yeah, HPV. Different types of HPV. That one's probably not the deadly one, but it's still contagious. So you don't want any of that. And plus, if you're going to use hot stones, you don't want to be unaware if they have a skin condition, and then you're liable. Okay. I had a front desk lady at one of the places I work at say, keep the lights down at a chiropractor's office. And she was not a massage therapist and she doesn't know, but we have to be aware of those things. And that is going to be on the chiropractor's fault, not mine, because I don't work under a license and they're telling me how to do my job. Yeah, I was an employee under their discretion, and that's against my license to massage anyone who has any communicable disease, and I'm not going to do that. So, and it's normal. Shingles, they say. Okay, so shingles is a vesicle. It's a type of herpes zoster virus. And it is from chickenpox because it lays dormant. You got viruses. All the herpes families just love you. They love you so much because they know you're going to get stressed, and they are going to eventually get so stressed out. The bacteria, and it's going to have a chance to grow and infect you and make itself known. They lay dormant in your dorsal root ganglion. So when you're stressed out, you can start that reaction. Like you might get a cold sore, you might get shingles. If you get shingles, it follows the dermatomes, your nerve dermatomes under the skin. So it lays in your sensory dorsal root ganglion of your posterior spinal nerves. An opportunity to infect you. So it'll take advantage and it'll give you a cold sore. Oh, you're not a cold sore. It'll give you little vesicles that are lined up. Boom, boom, boom. They spread by going to the next, and then the next one, and then the next one. And it only occupies one side of your body. So even if you do touch it on one side of your body and then you touch the other side of your body, it's just, that's how they taught it. And it may not even look like it's anything. It may just look like a little bug rash, but they describe it as, that is what they describe as some people saying. So under the skin, the burning, itching, painful. And then, that's contagious for like 2 weeks. So you can't see them for 2 weeks. You have to make a note of it because that's what you're responsible for. As soon as you see it, nope, can't do it. Can't. Yeah, come infected. All right. And then the low back pain, we did that. Oh, we talked about shingles. Yeah, so you always want to be not so stressed out. Everyone has to have a little bit of stress, but you don't want to be so stressed out because your body is going to react. It's going to be under attack. You got your body only has so much it can do to prevent infection and cure itself. So those are the 5 cardinal signs of injury, healing, healing the natural gut biota or biota of your skin or your oral cavity, your ears, your hair, your hands, your feet. Everything's got a microbiome in it. We also incorporates the gut microbiota that keeps us healthy, keeps us eating our nutrients. And then if you happen to be stressed out and you're not getting your regular massages, you're not checking in, you're not meditating, you're not deep breathing, you're not hydrating, you're eating crappy, high calorie, high fat, high preservative foods, not enough nutrients, you're stressed so much you can't even think about food. You're always shaking. Or you don't have that problem of your pants being too small because none of your clothes actually are too big for you. You're just really skinny from all the stress and a lack of desire to eat food. You're not exercising. You're just not providing enough healthy pathways for your blood nutrient supply, your lymphatic system to provide for your body and empty out contaminants that your white blood cells destroy in your body. You're not hydrating to flush them out. You're not hydrating to keep your blood pressure constant. You're not working out and hydrating to keep your blood to your blood supply, bone density, muscle strength and elasticity healthy. So yeah, you're going to start getting infections. Your body's immune system is going to be weak. You're going to be too stressed. So you need to calm down, take some time for you, realize you're hurting yourself, because once you break down too much, I mean, your body can destroy itself with destroying its organs, destroying the bone, depending on if you're depleted of electrolytes. You need also to work out because your bone depends on you working out. We get our calcium from our bone and our gut, and you're at risk of osteopenia. Bones, they depend on their attachment sites to the bone, and that constant movement is pushing and pulling on the bone. The bone has a periosteal lining that fluid goes through to get to the bone, where all the osteoclasts and osteoblastic activity is, as well as in the bones like the irregular shaped bones and the spine, making the white blood cells and the red blood cells for your body for all it needs. That osteoclastic activity is not going to happen as much, and no demands on the bone are made. There's a trabecula, a little network pattern where all the nutrient supplies can go through. You know you have strong bones when you have a rich trabecula. You can see in the x-ray. Yeah. Okay, so and then the muscle is taking that calcium from the osteoclastic activity, and then osteoblastic putting it back from the movement of your cardiovascular system so that you can get blood moving where it needs to go. Take the used waste. The lymphatics have movement too. Lymphatics can only get moving with muscle activity or your body moving. So if you're not moving and pumping your body, it relies only on the veins, which are just what happens from the valves working, which the muscle linings in the veins are the ones doing the work. No muscles are doing it other than like your respiratory muscles that are breathing and smooth muscles of your gut and other areas that have smooth muscle. Okay, and then so your bone density, you need to lift weights. You need resistance training to prevent osteopenia and fragile bones. We talked about the low back pain. One way is females, the 4 F's, or you could say the 3 F's and O for obese. 4th vertebrae, 40, female, obese. And then weak abdomen. The uterus in an unhealthy person, once you get a tumor, that uterus takes a large shape. Tumors are common, more common than one. Lots of tumors in there growing, compressing, pushing forward with gravity, falling. Or you're wearing something like a girdle to keep it in, to support your spine temporarily, but it does weaken your abdominal core, and then you have to keep doing it. And also note, if you do have a tumor, it's taking land from land that doesn't belong to it. It's taking it from the intestines and the mesenteric plexus. And that tumor, if you're wearing a girdle, will take from there, and it'll take that blood supply, that neurovascular blood supply to the, it'll shrink it. Muscle patterns in the gut will start shrinking as the muscle fibers die. Same with the small intestine, the large intestine, shrinking for your big tumor or that girdle restrictions, because you want to have like a 20-inch waist, but you have a 40-inch waist. This is going to die. It's going to have little areas of muscle atrophy. You're not going to have, it's going to be permanent. So Yeah. So be careful of that. Just work out and lower your expectations. Not everyone can have a 20-inch waist. Live within your means. It's too stressful to live outside of them. All right. Well, thanks again for joining me on this discussion of Q. Oh, okay, good. That was a different one. Hold on. Yeah. So I'm gonna see you Tuesday. Have a good one.